Thanks so much. So while we go to these every 2 week or even every 3 week meetings, what I'll do is I'll start with an overview of COVID and then I'll spotlight something. So this week we'll be spotlighting National Immunization Week. So with respect to our COVID-19 activity, we're really holding fairly steady. If we look at our overall surveillance, we're a little bit higher this week than we were a couple of weeks ago, but it is relatively stable. So we currently have 61,510 cumulative cases of COVID-19 reported in our 2 health districts. That's an increase of 169 since last week, and last week was 157 from the week before. So not at that low level that we saw 2 weeks ago, but still relatively low level. At this point, all of our jurisdictions are in green from a CDC community transmission perspective. With respect to our hospitalizations, we have 6 people in the hospital from our health districts. Last week we had 5, so again, holding steady. And unfortunately, our deaths continue to increase, which is expected given the significant delays that we have in mortality reporting associated with COVID-19. So we currently stand at having lost 991 of our community members to COVID over the last 2 years. With respect to variants, if we look at region 3, of which Virginia belongs, that's HHS regions, currently over 97% of the cases of COVID that for which testing is done are in the BA2 category, including BA2.121. It's a big mouthful. So that's that more contagious variant of the BA2. These are Omicron variants, and so these are the more contagious variants of Omicron. So I think that it's fairly good news that we're holding steady. We have to continue to look at what's happening across the country, and we know that there are areas that are increasing. So we'll keep monitoring the situation. And of course, we also know that with the abundance of home tests available, that the cases that we're reporting are just the tip of the iceberg. But overall, our picture is relatively stable, low levels of COVID-19 activity in both of our jurisdictions, in both of our health districts. So with that, I'll take a quick pause I think last time I did the spotlight and then ask questions or answer questions, excuse me. This time I think I'll stop there and then we'll spotlight National Immunization Week in just a minute to see if there are any questions about COVID-19.
Dr. Morrow, this is Tom Burr at WFXR. Where do we stand on getting immunizations for children under the age of 5?
Yes, so we still don't have, it has still not been approved. We're waiting on that. I've heard various reports. I think that most of the information that I'm seeing is that May will be the month where vaccines become available to our under 5 population. But we were really hopeful that we'd have that as an option for our youngest population a couple months ago, and that didn't happen. And so I think we just need to continue to be patient. The positive part of this delay is knowing that the folks who are responsible for approving the vaccine at the FDA, at the CDC, and at the CDC's Advisory Committee on Immunization Practices are doing their job. The FDA is doing its due diligence in making sure that when it is released, they've done everything that they can to make sure that the public knows that this is a safe and effective vaccine. And I think as a parent, although my children are old, I think all of us feel better when we know that the approving agencies are doing their due diligence. So it's hard for parents who are impatient to get their youngest children vaccinated. It's a necessary step to make sure that anytime a vaccine goes through the approval process, that it is safe and effective, and we can trust that process.
And this is Amanda Lee with
Hi, Dr. Morrow. It's Leanna with WDBJ7. Can you hear me?
Yes. And then Amanda will jump to you
great.
right after.
Okay.
Sorry.
Oh, So sorry. I just had a quick question regarding Paxlovid. I know the White House has been talking about its ability to be prescribed and its ability to treat people, helping to keep them out of the hospital. But it seems like there may be some confusion among the prescribing community about who is eligible for it and the availability of the drug. Can you talk a little bit about what you know about Paxlovid and who might be eligible for that?
Well, I think that I really prefer for the treatment. I know I've said this before, Leanne. I'm so sorry. I really feel like for the treatment options, it's really better to talk about to have the individuals talk to their providers. As you said, there is some confusion. The most important thing, and from a public health perspective, is that not only are we in a different situation with respect to COVID vaccines, but we're also, and that widespread availability for anyone who wants a booster, to be up to date. But also we have more drugs available to us to treat and mitigate the impact of COVID once someone has. Now, there are some nuances of the different antivirals available for COVID-19. And I think it's really important for people to talk. If anyone is at high risk for having a poor outcome associated with COVID-19, I know I like to pepper these with personal examples. So my son, who's fully vaccinated, if he were to get COVID, he has asthma. And so I would really, but he's young. And so I'd really want him to talk with his provider about which of the oral medications is the best for him. So what we really want to focus on in terms of public health messaging is that we have several tools in our toolbox that we didn't have in the past. Antivirals are one of them. Monoclonal antibodies are another. And really to make the decision of what is the best therapeutic for an individual, that really needs to be done at the individual provider decision with the patient for shared decision making. So I'm punting on that one. I hope that's not too frustrating.
And this is Amanda Lee, again with WFXR News. I noticed that the World Health Organization is investigating this mysterious uptick in hepatitis cases. And another thing they were looking at was cold and flu viruses that were connected. I wanted to know if you could comment on whether or not COVID-19 has any connection to hepatitis cases. Is this something we should be worried about?
I think whenever there's an emerging situation, we need to be aware of it and to increase our knowledge base. I want to make sure that I want to just take a step back, and we've been talking a lot about hepatitis in our community associated with hepatitis A virus. And I just want to take a step back and make sure that everyone knows that the term hepatitis is a generic term for inflammation of the liver. And it can be caused by all sorts of things. It can be caused by medications. It can be caused by agents, typically viral agents. And so we typically think about when we think about hepatitis, a lot of people are thinking that we're talking about hepatitis A, B, or C. Those are the sort of classic hepatidities. My understanding, and it's important to know that the numbers are still pretty small, is that this appears to be associated with not with the hepatitis A viruses that we traditionally hear about. It does not appear to be associated with COVID to our knowledge. It appears to be associated with something called an adenovirus. But we don't, I think that the biggest thing here is that we don't know. And I think it's really important for us to keep in perspective that that the numbers are small. And we should always be cautious. But at this point, the numbers are small. I have not heard of any cases in Virginia. And it's just really important for us to make sure that parents, one, don't panic. This does not appear to be a widespread concern. And two, for any reason, if your child develops signs or symptoms of hepatitis. And so if we think about inflammation of the liver, we think about abdominal pain, nausea, vomiting, and in extreme cases, yellowing of the skin or the whites of the eyes. We call that jaundice. And so if a parent has any concerns that their child has any of those symptoms, they should get their child evaluated. But I want to keep this in perspective that these numbers are still very low. This is an emerging situation. I am not aware that there are any cases in Virginia, certainly none in our districts, and that we just want to make sure that people don't panic about this, because at this point, there's absolutely no reason to panic. So I hope that was helpful, Amanda.
Dr. Morrow, while we're talking about hepatitis, we have seen more of an outbreak here. I believe you said it was related to intravenous drug use. How are we doing with that now?
So we continue to see cases. We're now at over 50 cases of hepatitis A. And again, this is a really specific hepatitis A virus in our community, continues to disproportionately impact our population who uses injection drugs and our population who is experiencing homelessness. We've been really so pleased with our community partnerships. As of this past week, we've vaccinated over 750 people, vulnerable adults, against this virus. And so we really are pleased with the partnerships to try to engage and protect a particularly vulnerable population. But it is important to just for everyone to remember that this is National Immunization Week, and we have so many vaccines available that can protect us. Children can be vaccinated against 14 different diseases. And it's not only beneficial to the individual, but it's beneficial to the family, and it's beneficial to the community when we optimize our vaccination rates. And hepatitis A is a great example of that. Hepatitis A is a vaccine preventable disease. It is tragic that we've had over 50 cases of hepatitis A in our community. And we just need to encourage people to continue to look at whether they're up to date on their vaccinations, and do what we can to help people understand that vaccinations are one of, if not the most effective public health tool we've ever had. Tens of millions of diseases have been prevented, and tens of thousands of deaths have been prevented in the last 10 years because of our vaccines. So thank you for asking that question about hepatitis A virus. We are having an outbreak in the Roanoke City, Alleghany Health Districts, and we have great vaccination outreach efforts out there to try to make sure everybody who wants to get vaccinated can get vaccinated against Hep A. I see 2 questions in the chat, so I'll just go to those quickly, and then I'll open it up. We've actually covered our spotlight, which on National Vaccination Week. Am I concerned about the escalating COVID cases in China? Should Americans be worried about the potential rise here? Well, I think that, that we always need to be aware, and this is true for any vaccine preventable disease, we always need to be aware of what's happening in other countries. There is reason to believe that the zero COVID policy in some countries has left them more vulnerable. It's important for us to understand that not only do we have high vaccination rates in our communities here in the United States, but we also had very high levels of Omicron. Our Omicron surge was extraordinarily impactful. And while it was devastating, and we saw record numbers of deaths and hospitalizations, and that was just tragic. One of the after effects of that is that we have a lot more people who have natural immunity. And so between the vaccination rates and high levels of natural immunity because of the Omicron surge, I don't think that we are anywhere near at risk of having that same level of surge, at least at this point. Then another question is, we touched on STI awareness last time. A new report showed syphilis cases are up substantially. Yes. And do you have any idea of what might be causing this dramatic increase? Is there any correlation between cases and COVID? One thing that I want to keep in mind, and I don't in any way want to underestimate the impact of syphilis. Any case of syphilis is a failure of our public health system and our healthcare delivery system, because syphilis is 100% preventable. We can't say that about a lot of diseases, but syphilis is 100% preventable. And so it's really important that we look at these cases, that we understand where the increases are. From a number perspective, even though the rate is going up dramatically, the number of cases is tiny compared to gonorrhea and chlamydia. And so I just wanted to put it out there that yes, we absolutely have to pay attention to the syphilis outbreak. We must make sure that we are doing everything that we can to test people, to get them treated. But I also want to make sure that we're keeping the overall burden of syphilis in scale with the burden of gonorrhea and chlamydia. That being said, what do we think is happening, and is there a relationship between COVID and syphilis? I don't know that we can say that there's a causal relationship between the two. What we believe is that people did delay care during COVID. And so someone who might have been diagnosed with syphilis may have not gotten into care as quickly as we would have liked, and may have transmitted it to other people. Again, knowing that it is preventable when it's diagnosed. When we can, if someone has syphilis, we do contact tracing, we do case investigations, just like we do with COVID, and we can prevent the transmission of syphilis. So if people delay care, then they can be out there spreading it. The other thing that's important for us to know is that with syphilis, the MSM population, the men who have sex with men population, is disproportionately impacted by syphilis. And so these are things that we need to look at. But at the end of the day, yes, there is a significant increase in the rate of syphilis. We are paying attention to it. Any case of syphilis, we should be able to prevent, and we're working on it. But it pales in comparison to our other STI numbers with respect to gonorrhea and chlamydia.
Dr. Morrow, this is Dave Seidel from Radio IQ. I have another COVID-related question.
Sure.
Just about looking at some of the statewide numbers, and as you said, locally we've been pretty steady. Statewide cases and hospitalizations have been pretty steady, but the testing positivity rate has more than doubled since the beginning of the month. Is there anything that we should read into that? Is that or is it not an indicator that we should be really concerned about?
Well, no, it's one of the indicators. And so we really look at a bunch of indicators. I've been looking at our wastewater surveillance data, which is, at least in our districts, has gone up a little bit. So we have to look at all of these pictures. I do think that we have more activity now than we had 2 weeks ago. Thankfully, our hospitalization numbers are again, 2 weeks is hard to establish a trend. So we're going to keep watching. With respect to positivity, again, I think we need to keep in context where we are. So if we had a 7% positivity that doubled to 14%, that would be really alarming. If we have a 1% that's doubling to 2%, we should keep our eye on it, but relatively, that's a different doubling, if that makes sense. So there are a lot of factors that go into positivity rates. One of those is who's getting tested. Why are they getting tested? So we look at other things like COVID, like ED surveillance, what we call syndromic surveillance. All of our indicators are showing relatively steady state for now, but they are inching up. All of our indicators are inching up. And so we're just going to have to remain vigilant. And positivity rate is one of those many indicators that we look at.
Thanks.
Sure, absolutely.
Dr. Morrow, Leanna again with WDBJ7. On the topic of National Immunization Week, we know that over the last 2 years, immunizations, not only here at home, but nationwide, worldwide, have been affected. Has VDH been able to determine, for the state as a whole or for Southwest Virginia in general, or more specifically, the kind of impact that COVID had on other kinds of vaccinations and the availability to them. Where are we seeing deficits, I guess, is the main question.
That's a great question. I don't have specific data for you, Leanna, but what I'll do is after this call, I'll try to find out. We actually, this is one of those situations where we don't have good local data. And so we rely on the central office data. I am not aware of our ability at this time to know where the deficits are. We know, as you very appropriately mentioned, that our concern is that because people delayed care, because there has been significant drops in a lot of healthcare indicators, that we are very concerned about whether our children are, whether we've been able to catch up. I will tell you at the local level, what we do know is that with our back to school clinics that we had in the fall, so we have a great relationship with all of our school districts to make sure that children are up to date in their vaccines, and we had great uptake in those. So if we look at the numbers that we have as a local health district, our numbers look good so far, but that doesn't reflect everything that's happening at pharmacies, at provider offices. So what I will do, Leanna, is I'll try to get the most current data, and I probably won't be able to get it before we send out this weekly report, but we will get that to you. I don't think it's going to be as current as we would hope.
Thanks, Dr. Morrow.
Sure. Okay, I'm not seeing any other questions in the chat. So we will get the weekly data review out to you, and then I will look for the most current VIS data for childhood the Virginia immunization system. I will look for the most recent data and get that to you, but I don't know how current it is. I should have looked that up before. All right. Any other questions before we close it off? All right.
And our next event will be in 3 weeks rather than in 2 weeks. So mark your calendar for May 17. Of course, if there's any breaking news, any updates, we'll absolutely get those to you. All right, with that, thank you all very much. Let me know if you have any questions.